I did a review in England, the findings of which come into the book, and we talk about the life course, early child development, investing in early child development, education, employment and working conditions, making sure that everyone has at least the minimum income necessary for a healthy life, looking at communities and environment, and not neglecting smoking, drinking, diet, physical activity, the usual things we think of under the heading of prevention, but taking a social determinants approach to prevention. So what I talk about are the causes of the causes. Smoking, drinking, diet are causes of disease. We need to address the causes of the causes. Why people lower in the hierarchy are less likely to eat healthily, more likely to smoke, more likely to be overweight. We need to address the causes of the causes. So there's a great deal we can do based on the best evidence. Well, government sets the context. Policy, economic policy, I mean government with fiscal policy can reduce poverty. Taxes and transfers can reduce poverty. They can invest in social services, in social security, social protection, in schools and the like. So government sets the context. But as an example of what health workers can do, for example, during my year as president of the World Medical Association, I set as my task to get doctors and medical associations involved in action on the social determinants of health. And that includes, among other things, seeing the patient in a broader perspective, working with others. So, for example, if you're dealing with young children, you don't say, oh, I think this child's neglected and there's nothing I can do about it because I'm a doctor. You say, can we work with child services? If the parents are in trouble, can we help in some way? Are there good child services? I, as a doctor, recognize the problem, but can I work with others who are skilled in dealing with that kind of problem? If you see an older person, you don't say, well, you know, they're obviously socially isolated and they're in danger of dehydration when it's too hot and freezing when it's too cold. You say, can we work with people who look at housing, who look at social services for the elderly, social care for the elderly? So working in partnership, there's a great deal that can be done right there on the ground. When I talk about empowerment, that sounds like you might be saying, get the government out of my life, you know, let me take control. And that's illusory. That's an illusion, because we need the conditions to be empowered. If you're hungry, you can't be empowered. If you've got nowhere to live, you can't be empowered. If you've had no good education, you can't be empowered. So we need to create the conditions for empowerment. I would say all of the things that I mentioned, early child development, education, good working conditions, having enough money to live on, a decent place to live, all of those are necessary to empower people. So it takes social action. But then we say, give people the means to take control over their lives.